Hello. I think I'm just going to wait a few minutes in case there's some people joining late and while everybody can connect to the audio. So I'll just give it a minute. Okay, perfect. So I'll just introduce ourselves and then we'll get started. So I'm Bailey and I'm a project coordinator at Newborn Screening Ontario. And I'm here with Nadine, who's a clinical content specialist at NSO as well. And Dallas has joined us from the eHealth Ontario team. So the purpose of our webinar today is to discuss OLIS and how you can access newborn screening results through OLIS via a clinical viewer. So I'll be talking about what OLIS is, why we're promoting it, and then I'll hand it over to Nadine. So OLIS is the Ontario Laboratories Information System, which is an information repository that gives authorized healthcare providers access to test orders and results from hospitals, community labs, and public health labs. So along with hospital visit data, medications, and imaging, these are all available in OLIS through the clinical viewers. And so as patients move between different care settings, the clinical viewers make viewing patients' current and past test results easier and enables treatment decisions to be made at the point of care. So why are we promoting clinical viewer access as Newborn Screening Ontario? So we send our screening results to the clinical viewers and into OLIS, and this is the quickest way to receive screening results, and it does not require you to submit a request to NSO to access the results. On average, we receive approximately 450 requests per month, and each of these takes a considerable amount of time to fulfill as our data management team has to match to a patient within our records and then fulfill the request. So your organization may already have access to a clinical viewer such as Clinical Connect or Connecting Ontario. Clinical Connect are for those submitters in Southwest Ontario and is managed by Hamilton Health Sciences. And accessing a clinical viewer does not cost any money. So as mentioned, newborn screening results have been contributed to OLIS since 2015. Many of you may have seen our bulletin series in October of 2021 that we were trying to promote the use of OLIS to access our results. After we had this OLIS blitz of our bulletin series, we contacted submitters individually who had submitted high volumes of results. The purpose of this was to increase efficiency of accessing results for our submitters and reduce the number of results requests that we receive at NSO. So as you can see in this graph, these are the numbers of requests that we have from hospitals in blue and midwiferys in the orange color on the top. So this is just a monthly graph of the number of requests we receive. So the red line indicates the OLIS blitz that we did in October 21. So as you can see, it didn't make much of an impact on the number of requests we receive. And we understand that for midwives whose patients are born at a hospital, they aren't the submitting location, so the reports don't go back to them. And so they have a real reason to be requesting for their patients to be able to close out those cases. But we do still promote OLIS as the most efficient way to do so because you don't have to submit through an external request. So since January 2023, we have received 1,500 requests for reports that have already been sent out to the submitting location. So that averages out to be 413 per month or 21 per day to fulfill. And midwifery practices account for approximately 59% of the monthly report requests. So the main reason that we receive results is for documentation purposes. On occasion, we do get requests for at-risk infants or infants who are ill or symptomatic, and we prioritize these, obviously. But the ones that are for documentation purposes, we aim to fulfill those within 14 business days. And then the majority of results are requested from midwives who are not the ordering provider on the requisition. So this is just similar information displayed in a graph. So as you can see, midwives account for most of our report requests, and NICU and sick kids are for the at-risk infants. So we obviously prioritize those. And then parents can request results as well, and legal guardians, family doctors do make up a decent portion of requests too, but midwives make up the majority. And so we have recently changed our report request procedures so that we can better capture the reason for a request. So many of them were not indicated, and this has been made a mandatory field so we can better prioritize the requests that we receive. Most of them are for documentation purposes, but if it's not indicated, we don't know how we should be prioritizing these among the other requests that we receive. So if you have noticed a change in the procedures, this is one of the main reasons for it. So I just want to highlight a success story that came out of our OLIS Blitz from October 21. So Mountain Midwifery was one of our main requesters, and they had requested over 800 reports between June 2021 to December 2021. And so obviously that's quite a significant number. And we met with them to discuss how they could access the reports through OLIS, and they had already been set up in OLIS. And so it was quite a quick transition for them to access these results. And so now they only request when they're unable to find in OLIS, for example, if they don't have a health card number, they won't be able to find them in OLIS, but I'll just give a minute so everybody can read this testimonial on the screen. But just to highlight, it improved the efficiencies on their end as well as our end. So it does make a very efficient process when we can all work together to retrieve requests as quick as possible. So I'm going to be handing it over to Nadine now, and I'll mute myself.
Thanks, Bailey. So in most cases, results are contributed to OLIS as soon as testing for all of the diseases is complete. Results are usually available within 1 week of the sample being received at NSO. However, testing for some of the later presenting diseases might take a little bit longer due to multiple tiers of testing that are required. Generally, if you're unable to find a result in OLIS for a baby that was screened, we ask you wait about 3 weeks before requesting results directly from NSO, unless it's urgent. So if there's family history of disease, the infant is unwell or showing symptoms. And if an infant does have a screen positive result for one or more of the diseases on the panel, we don't wait for all of the testing to be completed before we do refer them on to a newborn screening regional treatment center for follow-up. But in these cases, the results will be available in OLIS after the infant has been referred and we've received confirmation from that treatment center that they've been able to reach the family. You can go to the next slide. So there are some cases where results are not available in the clinical viewer. The first being when the patient doesn't have an OHIP number. Without an OHIP number, you won't be able to find the newborn screening results as it's an identifier that's required to match that patient. And the second is for unsatisfactory or screen positive results. And in these cases, results are not available until the appropriate people have been notified of them. So for unsatisfactory results, the healthcare provider who submitted that original sample is notified. And for positive results, we contact the treatment center through a referral, and that healthcare provider is then able to contact the family prior to these results being available in the clinical viewer. So there may be a short delay in the transmission of results for these cases. So as we mentioned, if you do suspect that an infant in your care might have a disease that's targeted by newborn screening, for example, they have symptoms, the infant is unwell, or there's family history of the disease, and or more specific screening analyte values would help inform clinical care, don't hesitate to contact NSO, the NSO clinical team for these results. Our phone number is up there, which most of you already have, or you can complete the results request on our website. This is a screenshot here of the results request form that's available on our site. You can fill it out and submit it directly on the site, or you can download it as a PDF and print it and fax it to us. And once this is received at NSO, we will send along the infant's results back to you, and we'll contact you to ensure we're providing you with the information that you require. So how can you access results through the clinical viewers? Authorized healthcare providers within the province of Ontario can access newborn screening results that are stored in OLIS in near real time through OLIS viewing solutions. And this includes any midwifery practice that's registered with their association. So the first viewing option is a provincial clinical viewer, such as Connecting Ontario or Clinical Connect, depending on your region. And the second option is directly through an Ontario MD certified electronic medical record. To retrieve results for a patient within the clinical viewer, you must provide the OHIP number, MRN, or an NSO patient ID, which can be retrieved through NSO, or a mix of demographic data on the patient. And these will all allow you to find the patient and pull up their information. But the OHIP number is required specifically to access the newborn screening results. With all the other information, you'll be able to pull up other results on the patient that may be in the clinical viewer, but OHIP number is required for the screen. NSO sends newborn screening results by fax to the hospital or midwifery practice that submitted the original newborn screening specimen. And when results are requested, NSO will send the results via fax to the requester. However, results will almost always be available in the clinical viewer before the faxed results are received, meaning you can access the infant's results earlier and much more efficiently through your clinical viewer rather than sending a results request to NSO. Also, results can be downloaded from the clinical viewer and printed for your records. They're downloadable in PDF format. So as a brief review before I hand over, you can access newborn screening results faster through a clinical viewer than by submitting a report request to us at NSO. And newborn screening results are contributed to OLIS immediately after they're finalized. You can download the newborn screening results report directly from the clinical viewer as a PDF file. And using a clinical viewer to access results is more efficient for everyone on both sides and has the added benefit of saving paper. So now I will hand over to Dallas and Mitchell, who are joining us from Ontario Health, to chat more about how to access and navigate the clinical viewers and OLIS.
Awesome. Thanks, Nadine. Thanks for having us. So my name's Dallas Driver. I am a client engagement lead with the onboarding team at Ontario Health. I'm joined today by a product manager from our OLIS team, Mitchell Richards. So I'm going to go over just a little bit about what is, Connecting Ontario specifically. What is the clinical viewer? What is the information that is available to you in addition to the OLIS lab results? We'll do a quick demo so that you can see how you would actually go about retrieving results and what you could expect to see within the clinical viewer for a patient. And then I'll just talk a little bit about onboarding requirements. So how you would go about requesting access to a clinical viewer and just a little bit about what you can expect about the process. Next slide, please. Perfect. So what is Connecting Ontario? Connecting Ontario, and by extension Clinical Connect, are secure web-based portals that provide real-time access to digital health records that are held by various provincial repositories. Access to Connecting Ontario leverages OneID, which is a provincial credential that is validated against a person's real-world identity. So it's one login, one username, one password that can be used not just for the clinical viewers in Connecting Ontario, but there are other provincial assets that leverage this, such as OTN or some CCO reports. Connecting Ontario includes information such as laboratories results from OLIS, hospital visit information, diagnostic imaging and reports, dispensed medications, and home and community care support services information. Next slide, please. So just to give you a bit more detail on the information that you would expect to see. So the first kind of major repository that we do have is the acute community care clinical data. So we call that the ACCDR. So that's all of the hospital visit information. So within there, you'll see, again, things like DI reports, you'll see discharge summaries, emergency department reports, which may be useful for your purposes, surgical reports, visit encounter details, all of that information that's contained within that patient's hospital record is contributed to us. And we do receive hospital records within Connecting Ontario for about 95% of hospitals in the province. So we capture nearly all of the records. There's, I think, 2 hospitals in Southwest Ontario that still do not yet contribute. That information is available within the Regional Clinical Connect viewer, and we are in the process of collecting their data to make it available within Connecting Ontario. Within the diagnostic imaging portlet, you'll find both the reports and accompanying images for a variety of different modalities, such as ultrasound and X-ray. Lab results have 5 basic modalities, as well as information on COVID-19, as well as medication information, which may or may not be of value to the organizations that are attending this. But just to kind of expand on that, so there's 2 sources of data for this. There's the Ontario Drug Benefit, so ODB claims information is available within the medications portlet, as well as controlled substances distributed through narcotics monitoring system is available, as well as COVID-19 vaccine information. Again, some of these pieces of information may not necessarily be useful to the organizations that are attending this call today, but we want to give you a bit of a comprehensive view of what's available to you. And on that one, okay, yeah, we'll go over this one first. So another thing that may be of value for you guys to have access to. So if you work with a particular hospital or a lab and you're wanting to confirm exactly what they do contribute to the provincial repositories that is then made available within a clinical viewer, we do have a contributor site. So you can go here and you can look up the particular hospital, and you'll be able to find out as of when we started collecting their data, what types of reports, and you can actually click through to the individual hospital and you'll see a summary of all of the different individual reports and artifacts that are made available from that site through the Connecting Ontario clinical viewers. So if you're in the clinical viewer and you're looking for a particular report or something like that that you might expect to see from a hospital for one of your patients, and you do not see that report, you can use this site to go and confirm whether we do in fact receive that information from the contributing organization. And that goes for a bunch of the other services as well. So you'll be able to go and follow through lab and pathology results across the top there and get a list of all of the contributing labs across the province. So I'm going to pause there and I'm going to snag your screen, Bailey, if that's okay. And we are going to just take a quick look at our training environment, which provides a non-PHI view of the Connecting Ontario clinical viewer. So we'll show you what you can expect when you log in, how to search a patient, as well as how you would go about pulling up lab results within the OLIS repository. All right, so the first thing that you're going to see when you log in is search for a patient. So as has been communicated, there's various ways that you can search for a patient. The most effective is by searching their health card numbers. So you would just input that information here. You can also search by an MRN or CRIS client number. If you have the MRN number and you know which hospital or contributing organization it's associated with, you can input that here. And under advanced search, this is the demographic search. So first name, last name, date of birth, gender, or street address, city or postal code. Again, health card number is the best way to find all of the information that you're looking for and is a prerequisite in order to obtain results from the OLIS repository. For ease of use, rather than having to search, if you've looked up that patient before or you're continuing to work with a patient, you can go to the My Workspace tab, which will give you my recent patients. So anybody that you've looked up, and you can set a time frame of 1 month, 1 week, a few days, a year, or you can pin patients to a My Patients list. So if you're looking for information on these patients on a regular basis, you can come straight to here and review the demographic information, again, just to make sure that you're selecting the right patient before you go ahead and access their record. So I'm going to double click this one, and that's going to take us through to one of our test patients, which is Mabel Zaleski. Okay. So now you land on the actual clinical viewer page. So this banner here at the top, again, just lets you know the patient information that you are looking at the moment. The most important thing to start with is the timeline. So by default, the timeline is set to information from the last 30 days. You can click 3 months, 6 months, 1 year, or specify a custom date range, which is what we're going to do in this case. Our test patients were created quite some time ago, so we need to adjust our timeline back to make sure that we're going to be able to see the visit and encounter data for this patient. One thing to note is that this timeline does read from right to left, as opposed from left to right, just to make sure that when you're looking at those visits and encounters, that you're looking at the right progression in time. So we are going to set this all the way back to 2015. Click go. There. All right. So once you set your timeline, you will be able to see here on the timeline inpatient, ambulatory, or emergency department visits for that individual plotted along the timeline above. And then you will see that each of these portlets have now populated with information for that particular patient. And we might have to go back a little bit further because I don't see any of the lab results. Oops. There we go. All right. So again, you can see these, if you hover over, this was an ambulatory visit at Health Sciences North. You can see this was an inpatient visit at UHN Toronto General, and then this was an emergency visit. So going again from right to left, the scenario for this particular patient is a diabetic. They presented in the emergency room for evaluation of a foot ulcer. There was then a return visit that they were admitted for worsening of that foot ulcer, and then some associated documents and notes for a surgery that was conducted. So you see the ED record and all of that stuff here. So within each of these portlets, again, documents and notes is related to the ACCDR, so the hospital visit data that we have contributed. If you wanted to see the ED record for this particular visit, you would just click this document icon here, and it will pull up the record that was submitted by the hospital. So you'll have all of the history, past medical, family history, anything that the hospital collected as part of that visit and then submitted to us. Associated to that as well is diagnostic imaging. So you can see both reports and the images for any of the diagnostic imaging that was conducted on this patient. And then I think this is kind of what everybody on this call is interested in, is more about the laboratory results. So under lab and pathology results, this is OLIS. This information is gathered from the OLIS repository. And if you want to take a better look at it, you would use this expander here in the top right-hand corner, just to expand that over top. And then you would be able to see all of the labs that were run for that patient. So the collection date, last updated, ordered as, what the test was, if there was any flags, high values, low values, the actual result for that test, as well as the reference range, whether that test is final, what the specimen was. So this just gives you kind of that high level view of the actual test data. And then if you want, you can click this reports button here. And this, you'll get the actual full report from the OLIS repository. So it includes all of the information, the performing organization, the reporting lab, specimen collection, demographic information. And then when you scroll down, you'll find all of the information related to that particular lab result. You can then print these if you want by clicking the Print Current tab. So there's always a time and date stamp on the bottom of each one that indicates the user ID that printed this information, as well as the organization that it was logged in under. When you print data from OLIS, you have to remember that you then become a custodian for this data. You are responsible to maintain this paper record in the same way that you would be responsible for maintaining any other PHI that's collected as part of your patient chart. One other thing that we do like to point out is that while printing results is certainly valuable, and there's lots of cases for that, there is no notification to you as an end user if there are any modifications to this result or if a result is withdrawn. So you can print this as a reference, but it's always good to go back to the clinical viewer itself when you're looking to review when you're looking to review patient data for clinical decision-making, just to ensure that you have the right information and you're not working from a report that may have been modified. So you can close that. If you're only really interested in looking at lab results, all of these portlets are available here on the left-hand side. There's lots of different ways that you can set up preferences, to add or remove portlets. So if medications information or visit encounters and summary or community information is, not really pertinent to what you would be looking for on a regular basis, you can remove those portlets so that you're only looking at things that are relevant to you when you log into the clinical viewer. There are methods for you to graph data from within OLIS. So if there's particular tests that you want to see trending on or anything like that, that capability is there. We have a number of training videos that are available for each of the portlet on our Connecting Ontario training site. And as an organization is onboarded to the clinical viewer, all of that would be made available and you'd be educated on where to get that information and how to find it. So I will stop sharing my screen. We'll go back to Bailey. And I guess if we like, I'm not sure, Bailey, if you want to go ahead, but we could open the floor up a little bit and see if there's any questions from anybody, either on, what's available within Clinical Viewer. Mitchell is here to answer any really OLIS specific, about results or timing or anything like that. So if you like, we can open the floor up and anybody that has a question can go ahead.
And you can put questions in the chat too.
Yeah. Okay, silence is golden. Maybe we've given a pretty good overview and everybody kind of understands what we're talking about. So Bailey, if you don't mind sharing your screen again, I'll talk just a little bit about the actual onboarding process and requirements. And then we can do a last call. And as Bailey said, if you're more comfortable posing a question in the chat, then you are unmuting your mic by all means. So as far as, implementation work effort for onboarding to Connecting Ontario, the first piece for smaller organizations, such as the ones attending the call today, is a request for access. So this process takes at most 15 to 30 minutes. We have an online request form where you go and you can give us information on your organization. So the name of your practice, we'll request a little bit of information on the legal status, as well as the healthcare that's being provided by the organization. We'll also request information such as legal signing authority, privacy and security contacts, and all of that helps us to draw up, which is the next step, which is your legal agreements. So there is a standard set of legal agreements that are sent out to every organization that's onboarded to the clinical viewer. Those are delivered digitally by Adobe Sign. Bailey, if maybe you could just let the slide play through. Yeah, there we go. So those agreements are standard. They go out to every organization. There's 3 documents that need to be signed. They will be delivered by email. It's just a click through. You don't have to print or scan or fax anything back to anybody. You would be able to provide a digital signature on that and send it back to us. The next piece is just do the OneID setup with your organization. So just depending on your size, we may set up an LRA, a local registration authority with you, which is an individual who's empowered within the OneID system to both register accounts as well as manage access. So, add users or remove users as necessary. If your organization is a little bit smaller and you don't have a lot of transition within your practitioners or your staff, you can also communicate with our OneID team by email, and they can assist the legally responsible person at your organization for managing those access requests. And then the other component to onboarding to Connecting Ontario is to complete training. So there are two pieces to this. One is for the responsible individual and the privacy officer. We have some documentation that they need to read through just to make sure they understand the obligations for access. And then there is mandatory end user training. So there's two modules that everybody that accesses the clinical viewer have to go through, both before their first view, and then again on an annual basis. One is related to privacy and security and just handling of PHI. And the other is just going through the medications portlet and some of the caveats around the information that's contained there. So the overall end-to-end onboarding process is much simpler than it was a couple of years ago, especially for midwifery as a group. And it will take about 3 to 6 weeks, just depending. So it takes about 3 or 4 weeks to do the technical deployment on our end to set up your organization for access. And then we say that usually it's about 6 weeks for an organization to make their way through the steps above, the access request, reviewing the agreements, getting through the OneID setup, and making sure that everybody's completed their training before they can access. And so that wraps up our portion of the conversation on access to the clinical viewers. I see there is a question. So the CHEO episode number is not responded. That's for Connecting Ontario. So I don't. Yeah, go ahead, Bailey.
That might be for us. I think the CHEO episode number is like the N number that you'd see, like the N 2023 05, for example. I'm guessing that's what you mean. Yeah, okay. We can definitely look into incorporating that and get back to you for sure.
Okay. Last call for any questions related to the clinical viewer, or if you have any specific questions for our OLIS people about, timing on reports or anything that's contributed that way. Otherwise, we'll hand it back to you, Bailey and Nadine, to wrap it up.
Perfect. Thank you so much for all this helpful information for our submitters. We really appreciate your knowledge and your time that you've given us today. But if anybody has any questions, I think most have the newborn screening email address that's on our submitter bulletins. So you can reach out to that if you have any questions later on. And thank you.
For those, if you have any colleagues or anyone who would benefit from watching over this presentation, it was recorded, so we'll be able to post this on our website after, and we will send out the link in one of our next bulletins so that this can be accessed later on, or if you just want to rewatch part of it as you're getting comfortable with using the clinical viewer as well. But again, as Bailey said, just reach out to us if you have any questions that come up as you are working through this. And thanks so much for attending.
Yes, absolutely. And Nadine, I believe you guys are going to provide the clinical viewer access request link, I think, as part of a bulletin that's coming out as part of this meeting, just so that everybody that may want access can go ahead and make that request.
Yes, absolutely. We'll include that as well.
Perfect.
Thanks for reminding me.
Yeah, no problem. Okay. Thanks, everybody.
Thanks, everyone.
Good afternoon.